Hi, everyone. Welcome back to the Human Narratives. This is your girl, Dorinda, and it is a pleasure to be back. I hope that you've had the opportunity to listen to the first episode that I put out, which was focusing on relationships. And I want to hear your perspective about what you have to say about it. Hit Spotify, Buzzsprouts, and follow me and also share your perspective. I want to hear some insight about some of the topics that you would like for me to also share as well, right? But like I said, it's a pleasure to be back to be able to talk about a very passionate area of mine, which is mental health, of course. But of course, today's topic is going to be focusing on DID, which is the dissociative identity disorder, which is also formerly known as multiple personality disorder. And this is also can be found in the DSM-5, which is the diagnostic book for clinicians, right, that we use in the field. So what is DID? Let's get in right into it. Like I said, this is an area of passion for mine, and a lot of people who know me knows that or know that I mental health is an area where a lot of times, whether it's due to culture, whether it's due to societal morals, or whether it's due to just one's own belief, it can either help or benefit someone who is in that state, based on their support system, if they have a better understanding of what that individual is going through. And a lot of times, even if you don't have a better understanding of what that individual is going through, it's just being able to have empathy and put yourself to in a space where you can better understand how to support someone, right? A lot of times we go into a support space and we automatically go in action. One of the things that I often recommend is ask someone how do they want to be supported, whether if they're dealing with a mental illness or a mental crisis or even a relationship crisis, right? Or whatever the case is. Ask someone how do they want to be supported so that you can show up in the way that they want to be supported, so that you're not feeling like you're being pushed away or they don't feel like you're being excessively too much, because sometimes that can be a problem as well. I see someone is going through the environment. But however, so what is DID? So DID, it is a complex psychological condition that is often characterized by the presence of two or more distinct identities or personality states within a single individual. So what that is saying, that you have two different personalities or more in one person. And these identities have their own names, they have their own ages, they have their own histories, they have their own behaviors, and they have their own ways of perceiving the world. Um, and, a lot of times when that is shared with a support system, they may assume that someone is just okay. Now you're just losing it. But this person could be coming from a sincere place of, look, I need your support. This is actually how I am feeling. So to just go into a place of distress can actually harm that individual and even causes that person's symptoms to get worsen over time, especially if they don't have that support system. So what are some of the causes of DID? It is, of course, associated with severe trauma of when someone experiences at an early childhood, at a very early childhood experiences. You see, my little accent is starting to come out, right? So it's a chronic emotional experience that may go through. It may be emotional, physical, or even sexual abuse. So this traumatic experience may be early on in the person's childhood stages, and like I said earlier, it may be it's chronic, right? And it may be emotional, physical, or sexual abuse. So this individual may start to disassociate whenever they may be confronted, or whenever they're in that space of abuse, or as a result of that abuse, whenever they're in that state of abuse, they may disassociate as a way of coping, to escape the pain and to escape the trauma that they're experiencing in that time. So, therefore, that's where a lot of times these different personalities may develop to protect the individual who is the host, and the different altars that will be created as a form of, being able to survive that abuse that that person is going through, whether, like I said, it's physical, emotional, or whatever state that person, or sexual, right? So what are the key symptoms of DID? Distinct identities. So this is where people with DID have multiples, like I mentioned earlier, identities. Or if your clinicians in the field, you will hear where patients will say, I have alters, right? So these alters, they, like I said earlier, may vary in ages, they may vary in gender, they may vary in languages, they may vary in personality traits. Another symptoms is that there are going to also be some form of memory gaps, right? The individuals may experience, amnesia. They may, a lot of times in treatment, you will hear where patients may say that I don't remember a lot of things from this period of time to this period of time. So there's losing time, or being unable to recall important personal information events. And the reason why that case is because maybe around that time is when this person maybe was going through a traumatic event or experience, and as a form of, or way of coping, they disassociated to be able to mask that pain, so that they are able to be able to, um, I would say I would say survive, but to be able to go through that painful experience, that that person may be going through. So that memory may be lost, so they may not able to. The person may not be able to recall important personal information as a result of DID, which is one of the important, one of the key symptoms. Um, Another form of symptoms that you may also hear or experience if you are someone that is diagnosed with DID, or if you are even a family member who have someone that is diagnosed with DID, right? How do you best understand what this person is going through, or how do you best support them? It's switching, because this individual have developed these different alters. They may switch at times if the person, the host, or whoever is at the forefront, is going through a crisis, or the system, the whole being is going through a crisis. Someone have to come to the forefront to be able to manage the whole system. So they may have to switch as a result. So the transition between different identities can be sudden, based on what is going on within that individual system. And it's often triggered by stress or reminders of trauma, right? So whenever you either see a patient is going through, they're doing really great, and all of a sudden they started, not doing so well, and they're diagnosed with DID, you have to ask them, okay, what has changed in your environment that is causing you to regress, or see some of the symptoms that you're seeing in treatment, or even as a family member, or even as someone who is diagnosed with DID. And another symptoms is depersonalization or derealization. This is a sense of detachment from oneself or environment, right? A lot of times I hear this a lot of times in treatment, where someone would tell me that I feel detached. I feel like I'm not even here. I'm not existing in my own body as well. Other symptoms may include anxiety, depression, even self harm. If someone is self-harming, it is very important to have a discussion. Of course, if someone endorses any form of suicidal ideation, it is very important to have a discussion and not assume that that person is just joking, right? Because it is important to ask the question. You are not putting it in someone's mind to kill themselves. Ask the question, are you suicidal? Do you want to kill yourself? Or are you homicidal? Do you want to kill anyone else? Those questions are very important so that you can provide the support that that person need, or you can refer them, send them to the appropriate places that that person can receive that support. 988 is a suicidal lifeline, a support system that anyone anywhere can in the United States can access for suicidal support or any type of mental health support that that individual or person may need. So help is out there, reach out, okay? So another symptoms that one may experience may be, like I said earlier, anxiety, depression, self-harm. If you're self-harming, please reach out to those resources that I mentioned earlier, because one of the things that is not a healthy coping mechanism. The thing about self-harming is that you may ended up hurting yourself or cutting too deep, and that may not be the right way of dealing with that pain. So if you're not journaling, or if you're not talking to a support system that bring a sense of relaxation to you, if you're not doing the things that bring a sense of happiness to you, none of those coping mechanisms are working, go to a mental health facility that will support you. Reach out to a mental health provider that will support you, or even call the mental health crisis hotline that will support you, or even chat and text. They have chat and text opportunities as well now available, okay, that you can text at your own privacy to receive the support that you need so that you don't feel alone. So, DID, of course, is diagnosed through a clinical evaluation, often with different tools that are the clinicians will use to kind of create a structured interviews, to get information about some of the symptoms that that person have been or has been going through, so that it can kind of understand the significant distress or impairments that is causing that person in their day-to-day functioning, right? So if this is a condition that is impacting the way you live every day, that's a concern, right? So that those are the information that a provider would normally, like a psychiatrist or even a nurse practitioner, may obtain from you to be able to diagnose. So, what are some of the treatments that are available? So, once a person is often, or after a person is diagnosed with DID, treatments can include psychotherapy. This is where the treatment involve like talk therapy, and this can basically focuses on integrated different types of identities, integrating different types of identities. Excuse me, integrating different type of identities into a very cohesive self and processing trauma, which the individual identify or develop different tools or learn different tools to kind of know how to manage the different alters and system as a whole, including oneself, right? The host. Trauma focused therapy, and this is where techniques like the EMDR, one of my favorites, Of course, is the eye movement desensitization and reprocessing. That's what the abbreviation stands for, and it helps one process, past trauma that they may have experienced as well, and also medication. Seeing a psychiatrist or, like I said, a nurse practitioner to be able to manage any antidepressant symptoms or anti-anxiety symptoms that may be co-occurring with the condition as a result. What are some of the challenges that DID come with? Right, stigma, society, humans. We are one of the most judgmental people in the world. It is not because intentionally we intend to do that, right? But because we sometimes care, and because sometimes we don't know, or because sometimes, media or a lot of things that we're influenced at impact how we make our decisions. We're not bad people. There's just a lot of things that are out there that sometimes impact how we develop our judgments, right? So, stigma may be a challenge where there's misunderstanding and sensationalized portrayals of DID in the media, which can contribute to stigma about how one may support a family member or how one may perceive it when they are diagnosed with DID, or even how a provider may service someone based on how that provider perceived DID in their way of learning, knowledge, or even morals based on how they were brought up. There's also the complexity of it as well, of the diagnosis, right? DID can be difficult to diagnose and treat due to, because there's it's a lot of overlapping symptoms with other types of disorders such as borderline personality disorders, or PTSD. So those are some of the challenges that can come, with diagnosing DID, of course. So let's talk about alters. Alters. So, what are alters? So, in the context of dissociative identity disorder, which is a short abbreviation of DID, alters, which is also short terms for alternate identities, are distinctive personality states or identities within the individual who is the host, right? The person who is carrying these different type of personalities, or these different type of alters. Each alter has its own unique characteristics, like I've mentioned earlier, and traits, and also roles. And what are some of the characteristics of, you know alters? They can be distinctives. Alters may differ in names, like I mentioned earlier. They may differ in age, gender, ethnicity, voice, or even physical mannerism. They often have their own preferences as well. They have their own skills. They have their own memories. They have their own handwriting, their own skills and abilities. Because, like I said, they were developed during when that person was going through a very traumatic experience, and that was their way of surviving. So they came into that person's life to be able to still coexist and survive that experience. So that was their way of protection as a result. So this is as a alter another person in the host. So there another characteristics of alters, of course, is awareness. Some alters may be aware of others, which is called co-consciousness, while others may not. There are times in therapy where you may hear a person say, well, I don't know what's going on. I have to check in with someone else. And that is completely normal, and that is completely okay. So communication between alters can vary. Relationship and even closeness and connectedness can vary between alters, and even cooperation can vary in the way they interact when it comes to conflict, or even when it comes to a state of being happy, may differ as a result. Another characteristics of alters, of course, roles and functions as well, right? It's like a form of community. Alters often have specific roles of or functions that serve the system and the collective of all alters, and all roles are there to do their due diligence to protect the systems. There may be times where you may hear, the host or even an alter say, well, this person may try to jeopardize, this situation or that situation. You may need to understand why that is going on, not to throw that author under the alter under the bus, but try to understand what's going on so that there is some form of stability in the system, excuse me, so there's this form of stability in the system for everyone. So another characteristics of alters is that their roles and functions, of course, often have, like I've already mentioned, that they have roles, common roles, and all the things. They're protector alter, right? Their systems, of course. This is a system, of course, right? So therefore, there are people who, at times when this host was going through a very traumatic experience, came to be as a form of protector. So therefore, you're going to have those who are protector in the alter in the system, who are there to defend the system from any harm, from any emotional, physical abuse in any sense, right? To be able to stand up for the host and everyone else in that system, as a protector. Then you also have the child altar. These are the little person or individuals, and they represent a younger version of the person, the host, often embodying like an innocence or the trauma that occurred. Then you have the prosecutor altar. And this can act out negatively. I mentioned that earlier, that sometimes there may be alters who may act negatively at times because maybe they feel like they may not have been heard. They've been dismissed often over the years, and as a result, that they may act out to be heard. So you may experience the prosecutor alter who may act negatively toward the system, or others, often reflecting internalized pain or abuse. And then you also have like the care taker alter. This is someone who alter who's nurturing and supporting of all their others and managing any emotional, physical needs that the system may need. Um, and then you have the memory, of course, altered, and this is someone who holds specific memories related to trauma or specific events, leading to memory gaps for the host or even other alters like in the systems. So transition, of course, between alters switching can result in, of course, confusion or at times loss of memory. So that's the difficulties and challenges that may come with it as well. Okay, so let's see, what are some of the types of alters. Let me get connected first, right? Connection is needed here. Human narratives, all about being human. Okay, all right, so I'm on. So types of alters, what are some of the type of alters? So while every system is unique, right? We are all different people. You can't assume that just because one person is telling you that they're diagnosed with DID, you're assuming that the next person who is also diagnosed with DID present the same symptoms, present the same way, or present the same alters. That is not the case. So it's really in importance to support people from an individual basis, to understand people from an individual basis, to also individualize treatment plans as providers as well, right? So types of alters, while like I said, they're unique, every system is unique. Some of the characteristics or common characteristics of alters are the hosts. Like I mentioned, this is the identity of the most often interact with the internal world. This is the person that interacts with the internal world the most often. So normally this is the person that was born into the being of that person's body, right? The host may not always be the original personality. Sometimes it may be, but sometimes it may not be. And also fragments. So these are alters that embody specific emotions or memories, and often it can be limited in scope. And you have the internal helpers. These are alters that assist in managing the system or even the therapy system as well, or therapy process. And then you have the introject, and these are alters or on in external features such as abusers, caregivers, or fictional characteristics. What do alters form? Alters normally form a coping mechanism, right? It's a form of being able to cope with an extreme trauma that that person may have experienced or was experiencing, often during early childhood when the individual's sense of self was still developing, who when they didn't know who they are, or when they were still trying to figure out who they are. So they were creating these alters were created, the mind disassociated and compartmentalized, which overwhelming experiences to protect that person from whatever abuse or trauma they were experiencing as a result. So the switching between alters, like I mentioned earlier, sometimes can be very confusing, can be very overwhelming and stressful, right? So switching can be stressful, or it can also causes one to be reminded of the trauma. It can be very emotionally overwhelming, and it can also lead to it can be triggered by specific stimuli such as a smell or sound, or even something that is tied to the past. So whenever you're working with someone who is diagnosed with DID, please understand what space that person is able to go into when you're trying to support them if they have to switch, or even as a family member, or even as someone who is diagnosed with DID, and so forth. So integrated versus cooperation, right? Integration versus cooperation. So in therapy, the goal may often be to integrate the alters into a unified identity. Even though this is may not always necessarily be or be desired for the system, but that is the goal, is to unify the identity. Of course you want the system, the goal always is like to create a harmony, like I mentioned earlier, in communication between alters, so there is no confliction, and there can also be integration if that's what everyone wants as well, right? Because there may be systems or alters who may want to be individualized and may not want to be integrated. So, what does everyone want, and how can everyone support everyone in that system to have that harmonic system and live happy? So, another thing is living with the alters. Individuals often experiences stigma, like I've mentioned, right? Misunderstanding about alters. But there are support system out there. There are therapy out there. There are many ways to learn and navigate through this diagnose and be able to live effectively, right? The altar represents the resilience of, the human mind, helping individuals to be able to survive and adapt through very intense, traumatic experience. So it is very important that, we reach out there and get the support when we need that support. The last thing I wanted to talk about is, okay, what happens when an alter is at the forefront, right? Let's say there is something going on. It may not always be a crisis. I often say crisis. What happened or what changed in your space that causes, a switch and causes another alter to be at the forefront, where maybe the host may not be at the forefront anymore for even for a while. you know what may cause that? So what happens when an alter is at the forefront? So the control of the body. So the alter takes over the physical and the verbal control, which may result in a very noticeable changes in that person's voice, their posture, even their facial experience, other behaviors, right? It is as if the alter is like the driver of the body, while other alters are like in the background observing, taking that protection that that driver in the space is providing. There's also memory awareness, right? Depending on the system to a level of consciousness. So this alter who is at the forefront may or may not retain awareness of whatever is going on in that moment that they can share with the system later on. Other alters may or may not access what the forefront alter is experiencing, because there may be at times where you may say, okay, what you may ask a family member what happened. They may say, I don't know, but you just experienced that. They may not really truly know, because like I mentioned, all the alters may or may not access what is happening at the forefront, right? So there may be that cause of memory gaps, like I mentioned earlier, as a result of that. There's also this perception and personality changes, right? Each alter has their own personality, own identity. So each alter may perceive the world differently, and they may be influenced by the world differently and interact with people differently. And that is very important to understand as well. And the switching to the forefront can be subtle, right? Where the tone of the voice is immediate. The way the vocabulary of that individual, the host changes, can be immediate. The body language can be immediate. And it can be some obvious signs, a complete change in demeanor and the action, and even the ability of what that you've been experiencing while you've been in that company of that person. And of course, the triggers for someone to come to the forefront, as I've mentioned earlier, there are several, but some of the ones that I wanted to mention is, of course, stress, as it's often the trigger for many, many of health issues that we have, right? Not just mental, but stress or trauma. So a protective alter may take control to handle a threatening situation if they feel like there's a stress or trauma situation presented to the system, or specific roles. A caretaker alter may front when emotional support is needed. They may feel like someone or alter needs that extra emotional support. An external stimuli may trigger like a smell or sound or situation that is tied to like a particular alter memories, can bring them forward as a result. Internal or intentional switching, right? If that's what the system wants happen. So some systems works to voluntarily switch, allowing alters to take control of specific tasks. So they're able to create that harmonious system within, right? Um, so there are times there are full consciousness. Other alters, like I said, may be aware of what's the alter at the forefront is doing, and can communicate to those internally. There's also partial co-consciousness. Some alters may observe but not interact fully, understand with what's happening, because they choose this to, or they don't want to. And also there may be some challenges, as I mentioned earlier, is the memory gap, the behavioral changes, and sometimes you may have experience or see someone who is going through the switching, and someone going through forefront, coming to the forefront, going through all those switching, you may see some fatigue. The frequent or rapid switching between alters can be mentally, and physically exhausting for the system as a result. But there are, of course, a lot of therapeutic, like I said, support that's out there for anyone that is diagnosed with dissociative identity disorder, which is also referred to as DID. Or if you have someone who is diagnosed with DID, or if you're supporting individual who are diagnosed with DID, this, you're not alone. A lot of times when someone is diagnosed with such mental illness, they assume that this diagnosis is their life. You still have a life. This is someone that you still, this is some a diagnosis that you still have to manage. We cannot allow mental illness or any other diagnosis to take charge of how we live. There's support out there, so you're not alone. Please reach out for the support system therapy, 988. There are chat and text. There's also the hotline where you're able to call and talk to a live clinician. There are psychiatric help out there. There are also nurse practitioners who are, competent, credential, licensed to be able to provide medications as well. I know a lot of times medication is not the first options, but if you understand that you need additional support besides just therapy, please take and reach out for the support that you need so you can live the best life that you deserve. Again, I hope this was very informative. Um, if like I said earlier, if you'd like to hear more about additional topics, please reach out and provide your comments. This is your girl. It has been a pleasure to share this information with you. Again, this is Dorinda. Have a wonderful day. Take care of yourself because you matter. And if you don't take care of yourself, who else can? You matter and you matter the most. Bye until we see again.